ma'am. What I have experienced in the procedure station.
Okay.
Okay, okay,
Ma'am, I
Dr.
think
Prasad, can
Jahangir
you
bhai,
repeat the
I
mic?
Yes,
think
I
Jahangir
think,
bhai is among us,
yeah, I
ma'am.
thought that was his wife. I wasn't saying anything. Unmute you.
That's
You.
our pleasure actually.
Dr.
How?
Abhishek,
Yes,
Yeah,
please.
yeah.
is it 2 millimeter for malignant melanoma? Are you sure?
Yes, it's a given from like Dr.
It's
Hasib in the
given.
last class. Yeah, I mean the group there is a picture you can search. Maybe I can also share in the group.
Uh, okay, so
It is there
please
in the
share it.
Telegram group. Telegram group, it is there.
Yeah, yeah, sure, sure. In the Telegram group, I'll share it. No worries. Wait, let me just share
The
it.
2 millimeter margin is for excisional biopsy for excision.
Hello, ma'am. Assalamu alaikum.
Yes, walaikum salam. I was trying to unmute you, but then I couldn't.
Ma'am, I have been trying for last from Ramadan, but what happened, I don't know.
I didn't
At
do
first,
anything, Dr. Jahangir. I don't know why you couldn't join.
yes, at first I usually just click the link. I used to click the link and I automatically joined the session. But
Yes,
from Ramadan when I'm trying,
yes,
but it's not happening in that way. They said I have to log in something.
yes.
But
There are
I
some.
am I'm not good at these things, ma'am. I am very much whatever bad in electronics or these things. So
Yes.
today, today my wife is in home, so I told her just do something for me. I want to join
Join.
the
Yes.
session.
So
Then
nice. I was thinking this is her name, but then I didn't say anything. I thought maybe she can also join. Why not?
yes, yes. And how is going, ma'am? How are you and how is everyone?
Everyone is good and everything is going good. I'm trying to. Yes, there you are. I can see
Hello,
you.
Jahangir
You've got
sir.
camera on.
Oh,
Oh,
I
we are
don't
so
know want to
lucky
on
to
the
see
camera,
you,
but
brother.
That's all right. I'm
Yeah,
trying
we have
to.
heard your voice so many times. Yeah, ma'am.
Who?
We have heard the Jahangir bhai's voice so many times, but
Yes. Now
didn't
you can
manage to
see.
see him.
all gray hair, all gray hair, because now everything still there. A barber shop is closed, so I cannot cut my hair anything. Just
Maybe
everything
Bobby can help you.
longer. Yes, she cut the boys hair, but I don't let her to cut my hair.
I'm
She might
trying to.
mess up.
I am trying to show what Dr. Abhishek has posted in Telegram, but it's not coming. I don't know why.
Ma'am, I have shared. This is from also, I already shared in the
Group, yes, I'm trying to
Telegram.
show everyone like here display it, but it's not.
Oh, I see, ma'am. Like the Zoom.
Yes,
Yeah, we need Zoom right
experimenting,
now, ma'am.
experimenting. That is good for webinars, but I'm trying to have it here as well. So, Dr. Jahangir, what is your plan? What are you doing these days?
Ma'am,
Yes. Your
now
exam done?
can I don't know how to off the camera. Can you please?
It's all right. Leave it on. They all love you and they all miss you. They all ask about you. So let them enjoy your
Yeah, I miss them.
glimpses.
I miss them all, and I miss them always. Um,
Your exam
my
done,
time,
Dr. Jahangir?
no, ma'am. My next date is 13th June. Uh,
Wish you good
I don't
luck.
know what will happen. Maybe
Wish you good
postpone.
luck.
Maybe I
No,
will postpone or what.
I don't think so. I think they are taking exams now. Some other members are also telling me they have exams booked in
Okay,
June.
that's good
So
news.
you're not the only one. And if their exam goes ahead, then your will also go ahead as well.
Yes, yes. And passing time, ma'am, now house husband. What is you call house husband? Taking care of kids. In lockdown period, they always in house. My wife is busy in duty. She is doing some extra duties. And in UK, if you do extra duty, this is highly paid duties. They
Yeah,
will never make duty free. In Corona, even though extra duties are highly paid duties, per hour
yeah.
£50, ma'am, per hour £50.
Oh
So
my
it's a
God.
huge money.
Yes, I
She is
guess.
doing some extra duty as I'm taking care of kids. Now I I used to cook a bit. I can cook little bit now,
That's good. That's
so
good.
it's a relief for her. Now I am enjoying how home husband life, house husband life.
You're talking as if you're looking after children. Your sons are, mashallah, big. I've seen them. They're not so small. They're not so little that you have to
Yes, yes, it's
babysit
very
them.
easy to take care of them. It's very
Yeah.
easy because if you know, yeah, you will just give them mobile or television, it's enough.
Yeah.
And just I used to teach, help them with the study 1 to 2 hour, and this enough, nothing else. And food already she cook all the food. It takes keeps in fridge. I just has to put it in oven, nothing else.
Yeah.
Easy thing, but main painful thing is, ma'am, for last 8 months, I didn't even touch the BP plate. I didn't touch any patient. This is the main agony for me. You know, I used to do 2 to 3 surgery at least daily, but for last 8 to 9 months,
Hopefully,
I
yes,
am
this
without. I'm
these
doing
days will
nothing.
be over. Hopefully, these days will be over.
Inshallah, inshallah. This is a global problem, so I
Yeah,
don't mind
it's
about this. This is the.
overall.
I am grateful to Allah that I could at least finish my MRCS.
Yes, of
That I
course.
could, I could have
Just
been in a great
imagine
agony
those
now.
people, Dr. Jangi,
Yes,
who had
yes,
exam in
uh,
Cairo and
yes, yes,
6 hours
yes,
before
yes,
their exam was cancelled. So just imagine
yes,
their
yes.
pain.
And the pain for Dr. Hama. I don't know whether she is present
I
here or
think
today or
she's
not.
not here today, but she was here
But
yesterday.
yes, I always feel about her.
She's doing
How?
good now. She's doing good. She
Oh,
has
fine.
recovered.
That's
She's
fine.
studying good.
That's fine. Ma'am, waiting for exam is a different type. Is a agony. It's agony. It's a pain.
It's painful.
Still, I am waiting for OIT. How long I will study? How long? Uh,
1 month
uh,
is enough, according to me.
yes, yes. But I finished all the study material 2 months ago, before my first exam. I have no study materials, giving revision everything, but it's painful. Even though I might
Everyone
not
said,
pass.
brother, like whenever you book your exam, then
Mhm.
the seriousness comes.
Yes,
It's
yes,
really painful. Yeah.
yes. Okay, let's continue, ma'am.
Give
Is there
them
any session?
advice, Dr. Jahangir. How should
Ma'am,
they?
see my elder one. Give
Yes, I've
salam.
seen them.
Assalamu alaikum.
Oh, she's
Big
the
Say
enough.
assalamu
elder.
alaikum. She's my teacher. Give her salam. Say assalamu alaikum.
Walaikum salam. How are you? I've
Say
already
something.
heard. I've already heard your English.
Forcing me to do that.
Don't force
I'm
him.
very,
Yes,
very
Dr. Jahangir, don't
uncomfortable.
force him. I'm not alone. I have 22 other members with me. Yes, we're
Yes.
all watching.
Say give assalamu alaikum. Say assalamu alaikum to my teacher.
Oh,
Hello. Yes.
assalamualaikum.
They are
See?
very shy, ma'am.
Yes.
They have learned
It's
one thing
UK's
here.
environment. Yes, it's UK's
If
environment.
if if if
We just don't want to talk.
See?
if
We
you
don't want
just
to talk. This is
no, he
UK
don't want,
talking.
what he want to talk. My, as I am holding headphones on my ear, that's why he's saying he's not listening what you are saying.
Yes.
That's
Oh.
and whatever, if you say something like eat this thing or drink water, then don't force me. Don't force
Yes.
me.
This is
What
UK
they have
talking.
learned.
Yes. Yes. That's what they. Yes. This is school.
So
All
as
children are
everyone
like
know
this.
me,
Yes.
those who are new or who didn't see me. So, if you, ma'am, you allow 1 minute, I will just
Of course.
introduce
The time
myself.
is yours. Yes.
Thank you, ma'am. You are so kind.
They
So, I
actually
am
talk
Dr.
about you. They actually miss you. They ask about you. I
Yeah.
said he is busy preparing for OET, and then I
No,
thought,
ma'am,
okay,
not for this exam. I am trying to join, but
yeah,
sometimes time doesn't. I used to work in the evening. I used to take care of the children. That something. Sometimes time is not that much available.
yes. Give them tips
And
and tricks. Yes, since you're
the
here.
I'm Dr. Jahangir. I am from Bangladesh, but currently I'm living in UK. So I passed MRCS Part A and Part B both from Dr. Samdin Malik Ma'am's group. I am her one of the most active student. I used to participate every day. So the basic thing for passing MRCS is just follow Dr. Samrin Malik. What I think,
Dr.
just
Jahangir, be
follow her.
honest. It
I'm 100% honest.
no, it
It's true, man.
Just
It's true, man.
I demand active participation,
yes, yes,
and
active
it's your
participation.
own sincere dedication to your own self.
Exactly, exactly. When you will actively participate, then you have to study.
Yes.
Without studying, without knowing, you cannot participate actively.
No.
So when you will participate actively, then you will automatically study. Then your preparation will go on.
Yes.
And what I have just have heard last melanoma, what Dr. Bharat said, he said just excellent. So
Excellent.
this is the
Yes.
thing. So today you might went through some other stations. So whatever stations you finish today, just don't go sleep. Or if you it's very midnight, then when you wake up at the early morning, your first job is to finish this topic first. What have gone yesterday, and what you are planning to study next day. Then
Yes.
if you prepare everything like this, every day 2 to 3 hours, if you study, then after 2 to 3 months you will be the just master.
Yes.
So it's very important to be a master in this MRCS to pass in the first time. If you become master blaster, know everything and not a single mistake in Samrin Malik ma'am's session, then you'll you'll you can assume you'll surely inshallah 100% chance of passing, 100%. Still, I can confidently say the result shows what the result shows in Samrin Malik ma'am's group. No one who actively participated, no one failed in the first time.
They
Actively
all
participated.
passed.
The
They all passed.
all passed. All
Because they
actively
were
participate.
sincere to themselves. They were dedicated to themselves.
Yes, yes. Those who will are dedicated, actively participates always, they will surely pass. Other students will also pass, inshallah. But I am telling you that there is no chance of fail if you actively participate every day.
Yes.
So my main tips is being actively participate every day. I mean, Samrin Malik Ma'am's group, follow her instructions. This is the main recipe to pass MRCS.
Dr. Jahangir, you don't know, I've been lucky to have a lot of dedicated members. And Dr.
Yes,
Abhishek, I don't know if you have seen, Dr. Bharat started, Dr. Bichao, and then Dr. Abhishek took the responsibility. He has scheduled all the topics, and there are certain topics which I didn't cover with you, Dr. Meena or Dr.
yes,
Arsane. I'm covering
yes.
them with them now, even those topics. And it's like they learn, it's like schedule they know already. It's not random or surprise anymore, but then they prepare and they come prepared for it. So it's
That's very nice.
yeah,
That's very nice.
healthy
It
discussion goes on.
yes, yes, that's very nice. But everyone should to, participate, and everyone should participate
Some are
because
shy, others are like active. Some of them are really shy. Yes, they come daily,
I,
they sit and listen, and they
no,
write
no,
and
no. Please
participate,
don't
but
do
they
that.
don't speak.
I will request to my fellow colleagues, my younger brother and sister. Please don't do that. It is the what a opportunity you got. You cannot imagine. This is a in exam. You will not. There will be second. There will be blink. You have to answer within blink. You have to answer within blink. You cannot think there. You cannot think there. If you think, you will miss another question. If you miss question, you will miss mark. And every station, if you can answer properly, every station you can finish within 6 minutes. Within 6 minutes, not 9 minutes. And 3 minutes you will be sitting there drinking water in front of the teachers, and sometimes there will be healthy discussion.
Yeah.
So but if you cannot answer properly, do stammering, think, then you will definitely lose one or two questions
And
every
points,
station.
yeah. And points as well.
Yes, yes. And this is a very easy exam because you know what are the questions. It
Yes.
is almost ma'am, how many stations
18.
we use it? No, not
No.
that. How many stations we have to practice? Almost it would be more than 80, 90, not more than that.
Yeah, I don't know. It's
Total,
yeah.
with the
Total,
total, yeah, man. Yeah,
total
yes.
syllabus.
Yeah,
Not
yeah,
more.
yeah.
Yes, sir.
Yes, not more than that. So you know, no question will be asked beyond this.
Yes.
So every time you have to take. Sometimes you will be fatigued. Oh, I took that history so many times. This is the easy one. Epigastric pain. Nothing more than that. But in exam, when you will enter the room, you will see that someone will shouting, "Oh, pain! I am going! I am going! My chest is going! I am dying! I am dying!" Everyone shouting. Then you will be puzzled suddenly. What happening here? But if you practice well, then you will say, okay, tell me, how are you feeling now? Okay, do you need any analgesics? Then first I have to calm down you with analgesics. Then I will take your history. Okay, are you comfortable with me? So these things will come fluently from inside you if
Yes.
you are confident enough.
Yes.
But if you uh, take a structured preparation and not that much full preparation, moderate preparation, shaky preparation, then you will forget all the questions. The patient will shout and cry as well as you will cry with the patient.
You had one such a case as well, right? In your
Yes, yes,
exam.
ma'am.
Yes. Please
And
tell
I,
them how you
yes,
managed, how
yes.
you handled.
Okay, okay, ma'am. Uh, and I think I might got 18 or 17 out of 20 on that station
Good. Yes.
because okay, that was a patient with acute severe epigastric pain. So there will be a stamp written outside the door. You will be facing towards the uh, lobby, not towards the question.
Okay.
And when the bell ring or they will say now start, then you have to look to the question within 1 minute. So I think you should always practice to read the stamp within 50 seconds because time runs fast there and the stamp sometimes is so big. There is lots of information there. But the main thing is that they will say that this patient presented with that. You have to take the history of the patient. So in the next session, you will enter, you have to take history of the patient. You have to bear in mind in that thing. So when I just entered, there is a young lady sitting on a bed, lying on a bed. She is shouting with pain and holding her chest by the hand. She is uh, what is rolling on the bed like this, shouting with the pain. So I first introduced myself. Whatever the situation is, you have to follow the basics. First introduce myself. I am Dr. Jahangir. Today I'm going to taking care of you. Do you mind to tell me your name and age, please? Whatever the situation is, you have to ask the name and age. Then she didn't say me her name and age. She showed me her wrist. She showed her wrist. Then I saw there is a number on the wrist. Then I just checked the number. So am I audible?
Yes, yes. We're listening. We're listening.
Okay. Then saw the I looked at her wrist and I saw the number. That means I checked her identification. Then I told the examiner, uh, sorry, I asked the patient, where is your pain? Then she showed me it's in the chest, and then she's shouting again, rolling on the bed. So I told her, do you need any analgesic at present? Then she said, then she became little comfortable. Okay, okay, doctor, you can carry on. Then I asked her, where is the pain? Then from when it had started, where it radiates, what it aggravates, then questions related to pain. Then suddenly she again shouting. Within my question, suddenly she again shouting and rolling on the bed. Then I looked at the examiner. I said, sir, my patient is having severe pain. I don't think that it would be wise to take history at that moment. First, I want to settle her down. Then I will take the history. Then when I said this thing, I looked at the examiner's eyes, they became very happy, and the patient also became very happy. Then all together said that carry on, carry on, carry on. Then patient became 100% calm. She is not now shouting, nothing. She is giving me very history very nicely. Then when last I asked her about eyes, what is your idea, concern, and expectation? Then she told me that my expectation is that I want to immediately subside my pain, do something for me, that my daughter's there is a ceremony for my daughter's engagement, so I have to attend it within 1 week. So I
Yes.
said her, okay, we'll try our best, but I cannot say at this moment. First, we have to take your history, then I will do some investigation and diagnosis properly. Then we'll come to the point. But I will assure you, we'll care you properly. Then, when I told the history to the teacher, examiner, so telling history, when you will tell history to the examiner, don't spoil that much time, because when you are taking history, the examiner is looking at you. He or she is listening everything, concentrating everything, whether you are kind to the patient, whether you are um, empathize to the patient or not. So just I said that the patient having severe epigastric pain for one day, but for last 6 hours it's become very severe, and the pain gradiates to the back, and she is very much comfortable on leaning forward position, and she has no history. She has history of taking alcohol. She was alcoholic. She was history of taking alcohol, and she has not experienced such pain before, and so my clinical diagnosis is this is might be a case of acute pancreatitis, and I have some differential diagnosis which I will exclude with some physical examination and investigation. And so then asked me what are your differential diagnoses. Then I said the differential diagnosis like this, and then what investigation we will do. Then I told that investigations. Then how will you manage? Then I told about the management. Then the bell rang. Question also finished. When the examiner will ask you about the management in history session, then you can assume that your examination, your history taking session went very well. Up to going to the management is the last question.
Yes.
So don't spoil much time in taking history, everything. Just the main key points. Key points. Then the history taking is very easy, because I want the patient with severe epigastric pain radiates to back. Alcoholic patient, it must be this is acute pancreatitis.
Yes.
Patient with severe pain in the right iliac fossa, pain, male patient, it definitely acute appendicitis.
Yes.
So in surgery, history is diagnosis is very simple. Patient with pain in the cuff, and patient has intermittent claudication. This is a peripheral vascular disease.
Yes.
So you will, before entering the station, when you read the stamp, then you will assume that this is the history of this disease. So you need not to ask lots of questions. You will just give emphasis of this your provisional diagnosis, and remain static to that point, and a few important other questions. During history taking, you will ask all the questions. You will take smoothly, because there is 6 minutes. It's lots of time. If you practice well, you can ask all the questions very nicely within 5 minutes. I took all the history within 5 minutes in history taking examination. Then within 5 minutes I took, then I got some extra 4 minutes. For 3 minutes, I got 4 minutes, because when you will finish, the examiner will not wait for 6 minutes. And when you will finish, just you will present your case. Then you will get more time. So if you practice very well, then you can present a comparative history within 5 minutes. Then you can preserve, you can manage extra 1 minute for you. So it will help to reach up to the management question.
Dr. Jahangir, tell them, how did you do practice?
And what I practice, it's a Samrin Malik ma'am's recipe.
Other than that,
Yes, and I always 100% followed her. Whatever advice she gave, I always followed her. She's my albatross who saved my life, and
No, it was
I'm
the
very much
God
grateful.
who saved your life. But tell them
Whole
your-
family,
your
my whole
practice,
family,
yes.
my whole family is grateful to you, ma'am.
Thank you.
And
Dr.
the
Jahangir.
thing is that in history taking station, you will practice in front of mirror, and everyone has a mobile recording. You will ask the question in the mirror, and you will record in the mobile. So when you will record in the mobile, when you finish question, then you will play the recording. You will listen to the recording. Then you will say you can easily see that what are the question you missed or what are the question you asked properly. So in history taking station, there are some important key questions you must have to ask. If you don't ask, then you will lose lots of mark, not 1 or 2 mark. Like patient with PLID. If you don't ask the red flag question of PLID, like patient has a perianal sensation intact or not, patient has bladder bowel incontinence present or not. So whatever the question you ask or not, if you don't ask this question, red flag question, you will not get proper mark.
Yes.
So every history taking, patient with rectal bleeding, suspicious of rectal malignancy. If you don't ask about family history, if you don't ask about sudden weight loss, so you can think that you will lose lots of marks. These are the red flag questions. You must have to ask the red flag question. In every history taking, you will find out and give red marks. The most important red flag questions. You have to ask these questions definitely. Then if you practice in this way, and what ma'am says 30 times, so you have a lots of time now, because before September there will be no
Their
exam.
exam will be in October. No
Okay.
OSCE exam will be held before October.
Yes, so you have lots of time, and you practice in that way that October you will appear one time, you have to appear, you will pass in one time,
Yeah.
because it's a very expensive exam, and
Mental
it's
trauma and torture
an
is
exam. The exam is so
Yeah.
traumatic, so traumatic. It's a 5-hour exam. Whenever you will appear, you will never wanted to be appear it again, because it's a 5-hour exam. You will lose your, in our language we call this hayat. Hayat means age. This type of exam, if you appear one time, you will lose your 1 or 2 year of hayat.
Okay.
That's funny.
Yes.
True.
Yes. Any
But
of
I
you
am
want to ask Dr. Jahangir any questions? So it's your luck that he came himself
no,
today.
ma'am. It's my luck that
It's
you.
their
I am
luck that you
for
came today. Yes, during
many day I am
discussion.
trying to join,
Yes.
but unfortunately I failed to join. Now today I luckily joined.
No, that's good that you came. So now any of them have any question or confusion or query, because you have recently appeared and you have passed in your first attempt, you can give them first hand information. And
Yes,
this is
yes,
what they need.
yes. A lots of people will say lots of things, but don't take it lightly. And please take it seriously if you want to pass, and you will definitely pass. And this is a well judgment exam. There is no biasness here. There is no the nothing here. If you can answer properly, you will definitely pass. If you have a very good preparation, you will definitely pass. Not like FCPS MS in our Bangladesh, there is some biasness, but here there
Yeah,
is no
yeah.
biasness.
Yes.
So, which was your center?
My center was the London. This is the highest, best center, best prestigious center in the world.
Yeah, and I never recommend it. Still,
Ma'am
Dr.
never
Jahangir.
never recommend, and ma'am was little bit of hesitated for me, and she always told me that the preparation what you have, you will definitely
Yes.
pass from London or whatever it. And ma'am always thought that if it would have not been you, then I would have not recommend anyone to appear in the London. But my experience is very good. The examiners are there is very kind, very good, very gentlemen. They are British gentlemen, and I felt very comfortable there. At
That's
first,
good.
I was very shy when I saw all the British people, British students were with me, and at first, but I thought not the students, the ma'am, what is called the helping hands, the volunteers who showed us different room.
Yes.
They are also very kind and helpful. They saw me, I am very nervous, and I am looking for, when I come out from one station, then you have to go in another station. There is a beautiful direction, arrows to go another one, but I was nervous. Then when I just came out from one station, I was just shouting, where I have to go, where I have to go. Uh,
Yes.
because I don't want to spoil 1 second. Because if you lose time, then you will get less time to study the stamp. Okay.
Yes. Yes, this is
So
important.
what?
Tell them. One
Yeah.
minute they'll
Yes,
get.
yes. This is important here.
The adrenaline rush, yeah, brother.
Because this is a matter of life and death. For me, I do not have to waste any time. So then when I did this thing one or twice, then they recognize me. Then whenever I just came out from the room, then one volunteer used to escort me. Please come here. Please go there. Go there. Eh,
That's good.
they were they were very serious about me. So they were. I felt very comfortable, and I seen and there were examiners, all the British, but there are some examiners from, I think they might be India, Pakistan, or Bangladesh origin, Asian origin.
Yes.
They were also very nice, ma'am. They were also very kind. Because if I did any mistake, they used to give me some hints, give me some signs, mm, shaking their head. They did very good signs.
Yes.
So, but I still don't recommend those who has visa issue, who because before exam it will be difficult for you
Yes.
to run after the UK visa, because if they refuse your visa, then all the money will be spoiled.
And nowadays there is no international center announced as yet for OSCE
Yes, yes.
exam. It will be only Ireland and England after
Oh,
COVID-19, as far as I
and
know
and
right now.
and ma'am, those who
Ma'am,
will come
They'll be
UK
quarantined
or
as well.
Ireland,
Yes.
14 days quarantine. They have
Yes.
to stay
At
14
their
days
own
quarantine.
expenses, Dr. Jahangir.
Jahangir bhai, the Malaysia Center, Kuala Lumpur is booking is still open. Should we book or not? Can you please suggest this year?
Kuala Lumpur.
September, yeah, the 19th September.
Ma'am, definitely, because if you don't have option in India,
Yes.
uh, then you can go Kuala
Definitely, yeah,
Lumpur,
Kuala Lumpur.
definitely.
And last time my
And
Kuala Lumpur result was very good. All
ma'am,
my
I want to
members
tell
passed. Yes.
one thing in front of you, ma'am. It's to you. Those who will appear in Kuala Lumpur,
Yes.
and if they have any issues or especially to stay there or any support,
Yes.
then my younger brother, he is the vice president of Malaysian Citibank.
Wow, that's
Uh,
good. Great.
That's great. Yeah.
Great.
my younger one, ma'am.
Yes.
I have my younger one.
Yes.
So not
Mashallah.
that
Yes.
rich, not that thing, but
Yes, it's
definitely
about
will
the
help you.
sincerity. Yes. Yes.
Exactly, exactly.
It's about the trust
So
and faith. Yes, that's what I
exactly,
say.
those who need help, contact with Samrin Malik, ma'am. Ma'am will
Yes,
tell
or
me. Then I will
with
keep
you.
the
Yes.
number of my brother. Then you can communicate with him before you go.
That's good. Thank you so much. That's
you.
My
very
pleasure,
kind of
ma'am.
you. Yes, because in unknown place to give exam, everyone is little stressed and confused
Yes,
and
yes,
worried. So if they get that guidance, sincere guidance,
yes, yes,
it
yes.
will definitely
And
help them. Yes.
Malaysia is a very nice country. I
Yes.
visited there
Yes.
several times.
Oh
I felt
wow.
like home there, ma'am. It's a
Really?
Euro, it's
You
ma'am.
had
It's
no
a style.
language problem?
No, ma'am. Basically, my brother with me, so I had no problem with to talk anyone else.
Wow, that's good. That's
And
good.
there's people know little bit English, ma'am.
Yes.
And it's like Euro, style is European country, but Muslims.
Yes.
So that was comfortable. Everything was halal. So I don't need to search for where is halal, where is something like that.
That's good. Yes.
But in Europe, you have to search for that where is halal present.
Yes. Yes, that's true.
So I think it would be better not to lose to 1 year. mm, appear in Kuala Lumpur, and Malaysian visa is easy for Bangladeshi people. Especially, I'm talking about who are from Bangladesh, and it's very easy. They will give you 1 month visa, so you
And
can book
especially
it.
now when they have time because of COVID, and now their preparation is good as well.
Yes, ma'am. So iron should be strike when it is hot.
Yeah,
So
yeah, yeah, yeah. That's the best time.
yes, yes,
True.
because if 4 month, even 6 months, 7 month, 8 month is good, but 1 year is not good. After that, you
Yeah,
will be fatigued. You will loss of interest in studying the same thing. You will fail, loss of
true,
interest.
true.
Ma'am. Thank you so much. So kind of
Thank
you.
you so much, Jahangir bhai.
Thank you
And
Also,
so
so
much,
kind
Dr.
of you to
Jahangir.
give me
Yes,
I will join, ma'am, sometime. Please kindly give me your permission to
yes,
join,
yes. Of
and
course.
I'll
Feel
be
free to come
grateful.
whenever you are free.
Ma'am,
Feel free to join. My
this
timings
group
are
is my
still.
home. This
Of
group is my
course,
home, my family. I
definitely.
always with
You're
there.
their brother, and we all would love to have you. Like, come on daily basis. Most welcome. Like, if you'll come on daily basis, it will be good. Like, then I'll be also like, okay, I can take little rest, and you can take over,
Thank you,
and
ma'am.
then
So kind
yeah,
of you.
it will be good. Like, yeah, whenever like you have time, my timings are still the same. You can come over,
Yes, ma'am.
and
I
then
follow
yeah,
always follow the group. Uh,
yeah.
Hello,
So
Dr. Jahangir.
Dr.
yes, yes.
HK, this is Dr. HK, your fan.
What does HK? What does HK mean?
His name is difficult. Hare something. Hare something. His name is difficult, so I also call him
uh,
HK.
yes, yes. And Dr. Zia is also there. They are
Yes.
very sincere, ma'am,
And
as
Dr.
far I see.
Kazim, one another new doctor. He's also very good.
Hello, Jahangir sir.
Okay.
How are you?
Hello, how are you, Dr. Zia? I saw you.
Yes, sir.
You are quite
Struggling,
sincere.
struggling, but trying.
Dr. HK
That's it.
also sincere. You guys will surely pass, inshallah, in fast time.
Definitely,
You can
yes.
sure about that. If you can keep it up, continue like this. You, I am watching you for after 2 months. So
Yes.
you have been sincere for last 2 months. It's very important. Very important.
Sir, I had a question, sir.
Please.
So, is the time of second station just started immediately after finishing the first station?
No.
You said you
You'll
rushed.
finish.
You have to rush.
Yes, you have to rush because uh, I have to rush because the thing is that I'm running with the time. That's why. Because if you they will not nothing will wait for you if you don't give yourself some time, because I am coming out from one station, okay, then I need
Okay.
to stand few seconds in front of other door to before reading another one to erase the previous one.
Okay.
That's why I am running to stand for few seconds. If I after coming from one station, if I go to read another one, then my head will be jammed. So and there is 1 minute gap. So this 1 minute you have to properly utilize this 1 minute.
So from one station to another station, there is 1 minute gap. I mean, you have to
Yes,
reach the another station within 1 minute.
exactly, exactly. Then
Then the bell will
if you
reading.
reach if you reach there within 10-20 seconds, then you will get 30 or 40 seconds. Then by this time you can say Allah,
Take.
by the name of Allah, by the God, whatever you say. You will get time. Then the bell will ring again. Then you will turn around and see the instruction of that station.
Okay. Thank you very much, sir. Thank you.
Don't
And
bother
nice to
for
see
these
you.
things. Don't bother for these things. This will happen automatically. Don't worry about these things. Okay.
Okay. Okay.
And don't run for which center is good. I don't like this question. Everyone is run after this question. Which center is good? Which center is passing rate is good? This is not the fact. If you have very good preparation, you will pass from any center. This is the international level examination. This is a well maintained examination. Everywhere same question, same attitude. So don't bother for that. Don't worry about that. You will, what ma'am says, you will select that center which is nearer to you, where you will get easily visa, where is cheap for you in air expense or in hotel accommodation. You will always choose the one.
Thank you for your kind words, sir. Please keep us in your prayer.
Don't call me sir. Call my name, please. I'll be happy.
They're calling
Okay.
with love. They're calling you sir with love.
Thank you.
Yeah.
Even
Right.
we don't
Yeah.
call something only the people of
You call.
UK.
Yeah,
I call
something
Samrin
good. I
ma'am
feel
because only the people of UK should call her Ma'am, not her by her name. She once told that.
No, it was a joke.
Ma'am, Jahangir sir was a assistant professor of surgery of our
Yes,
country, so he's
yes, I know.
automatically my sir. I cannot say him by or his name.
No,
I
no,
am gonna
be
say him, sir.
comfortable. When you will come in UK, the head of they always uh, call by name. No, sir, nothing here. The most junior trainee will call the head of the department or the professor by name.
Okay, sir, I will see that when I reach the UK. But
But one
till then,
important
you are my
thing,
sir.
I'll tell you everyone. In my exam, I appeared in London in my exam. Uh, I every teacher I used to tell them, sir. I showed very humble and respect attitude towards them, and it really worked. Believe me. Whatever they say, still when they hear this attitude or if you very much humble, kind, gentle, this really works.
Yes, agree. For as long as it was concerned about me, they all started calling me ma'am, madam. I don't know. In the beginning it sounded so difficult and different because I wasn't used to it. I am used to being called with my name, but then
Yes,
my
yes, ma'am.
mother said, "Let them call. At least in this way they will respect you." And then I said,
Exactly,
"Okay,
ma'am.
all right."
Ma'am, you deserve that. You deserve
No,
that.
Dr. Jahangir, it still sounds. I don't know. It sounds funny.
Not funny, ma'am. What uh, you played a tremendous role in our life, all our life, who are
Dr. Jahangir, this is
actively
the
passed
way,
from
and
you.
this is your greatness, and this is like it was something you deserved. It was your own effort. I'm just a mentor,
That's
helping
the
whoever.
important thing here, ma'am. Yeah, I had no patient. I am here alone, sitting all alone in a room. No, I cannot. I don't have anyone to talk with even. Didn't have anyone to share with even. I don't have any patient, no book, nothing. Just I had Shamrin Malik and I passed the exam.
It was your good luck and your hard work. This is what
Yes,
like I want them to not just rely because on me, because in examination they will be giving exam. So
yes,
what I
yes.
say they should follow.
But
Okay.
you are making a good platform. They have to just work on that platform, nothing
Yeah,
else.
I hope they will. And because this gang that I have right now, they are very active and
Yes,
they are
yes.
very
And
intelligent.
most of them will pass from this group, ma'am.
Definitely, all of
Most of
them.
them, all of them will
Yes,
pass in first chance, inshallah. All
especially
of them.
these 26, 30 people that they come regular, they will definitely pass right away.
It will be a great achievement.
Yes,
The life will
definitely,
be
hopefully. People say that
pass.
I'm creating army of MRCS.
Yes, yes.
And then
I think
that's
I
good.
tell you, everyone, pass as quickly as possible and come to UK. There are
Yes,
lots of job here,
right now
and
especially.
up to 2 to 3 years, it
Yes,
will remain so. As the Brexit will go on, then this opportunity will
will vanish.
stay for
Yeah,
2 to 3 years.
yeah.
After 2 to 3 years, when they will be saturated with doctors, there will be less requirement for doctors.
Yes, but and then they should remember one thing. One doctor has requested me to make a video on or a recording on life after MRCS, because MRCS is not just for England or Ireland. It is equally recognized in Australia, New Zealand,
Yes, yes.
and
Australia,
yes,
New Zealand,
and what other, and
and ma'am,
Gulf, and all the Gulf Gulf
on all the
countries.
Gulf in Middle East. If you
Yes,
want to be a consultant in the Middle East, if you pass FCPS or MS from Bangladesh, it will not work as
no,
the
it won't.
MRCS will work.
With
And
MRCS, yes, they can have extra.
full Middle East, you
Yes,
will be paid with high salary.
yes,
If FCPS or MS doctor gets 3 lakh salary and MRCS doctor gets 5 lakh salary,
yes,
huge difference.
definitely.
Sir, what about Singapore, sir?
Yes, yes,
Yes,
also
definitely Singapore as
Singapore as
well.
well.
You don't know
Singapore as well.
MRCS can be given in Singapore as well. So all these countries they recognize Singapore.
Yes,
Those who
yes.
have centers like Malaysia, Singapore, Thailand, all these countries.
If you pass MRCS, the world will be, except USA, the world will be on your feet. You can
Yes,
put your feet anywhere. except USA.
USA will accept you when you have done your fellowship, FRCS.
Okay, ma'am.
Yes, because there are only three boards. There is Australian board, American board. No, okay, European board, American board, and FRCS. Three boards that US accepts.
Dr. Jahangir, you are supposed to arrange some the stations for
Workshops,
procedures.
yes, yes.
Remember?
Yes, yes, I
After
will
his
definitely
OET,
do.
after his OET,
No,
definitely.
Yeah, yeah. Keep it in mind, sir.
surely, surely. And for this procedural, ma'am, can I say some words about the
Of
procedures?
course, of course, of course. This is your
Please,
Don't
sir,
time.
wait.
please.
Don't wait for the exam, because I want to tell you something. All you are now in job or you are in training. Someone may be honorary, someone may be medical officer, someone may be registrar, someone may be ST registrar. All you are in training, most probably. So you are now assisting surgery or performing surgery. So you will watch the video how to don a gown, how to don a gown, how to remove a gown, how to take a wash, surgical scrub, how to take a surgical scrub. You will watch the video and you will make a practice in your daily life. How to wear gloves, how to suture. You will the basic. Then you will always suture like that way. You will give the notes in that way. So before exam, you need no practice any extra things. If you practice from today like this, then this will be habit for you. It will be a habit for you.
Yes. Whenever you get time, this is what Dr. Jahangir is
And
saying.
if you think that okay, before exam I will just practice the note, and in the exam I will,
Yeah.
you can never do it in the exam. Believe me, in a stress situation, in such a stress situation, you will forget all the notes,
Yes.
and you will there will be a haphazard things. If you practice from today in your daily life, then and this will be very smooth and easy, and you need not to spend any time before your exam,
No. Just take a
not a
shoelace
single
while you're
moment.
sitting, just like Dr. Jahangir is sitting now,
Okay.
on the
Yes,
armchair. Start doing it. Go ahead.
yes. And you know, I used to tie the lace of my children's shoe, then I
Yes.
used to practice the notes.
Yes.
Then you know that I am a assistant professor of surgery, and I had a 10 to 12 years practice of surgery. Even though, you believe me, I bought some suture material from Bangladesh. I brought needle holder, tooth, for say everything from Bangladesh, because they are my relatives coming and going from Bangladesh and UK. Lots of relatives there, so they used to bring. And even, ma'am, you believe me, I brought tuning
Ye-
fork from Bangladesh, and
okay.
one
And
and
some things you ordered by Amazon or
yes,
eBay.
yes, ma'am.
Yes. So yeah.
And ma'am, sometime I became just psycho for study material. If I don't get this thing, I just become puzzled. So my wife noticed that suture material is not coming from Bangladesh, and the someone is making delay to reach.
Yes.
Then
Yes.
she ordered through Amazon and brought this thing to me,
That's good.
and
That's
I
nice.
practiced. And then I should have said that I am a very good surgeon. I know all the things. Why need I need to practice?
Yes.
But I always remain as a student. Ma'am can say like this. I never showed that I am a surgeon. I know these things. I know
I
these.
only came to know Dr. Jahangir when I read your wife's status on Facebook. That was after you had moved to UK.
And I always remain like a student. My attitude was always like a student, still like a student. So uh, that's the way I think it worked. Because there are a lots of people. Ma'am said in our group, associate professor, assistant professor, they used to fail in the MRCS exam
Yes. Many, yes.
because they used to take it very lightly. Oh, it's a easy exam. I know everything, but the thing is not like that.
Yes.
It's a very easy exam, but you have to work on the proper way. Work on the track, proper track. Not the proper track. Now you are walking. This is the proper track.
Dr. Jangan sir?
Yes, yes.
Sir, I remember your interview post your results. That was very much admiring also. That motivated me.
Yes,
And
yes,
during the time you even told that you have bought few things from Amazon and you practiced at home. And
yes, yes.
you even told that you'll be showing us what all you got,
Sure,
how you
sure,
will be
sure.
practicing.
All the things I kept all the
You know,
things.
I have searched in Amazon. I couldn't find anything. Probably because of this COVID, they might have closed.
No, no. You didn't
You,
know what keywords to put and what to look for.
I
Yes,
shared
ma'am.
it with
Kind
ma'am.
of.
Ma'am, if you have or
Yes, I have him. I have it, but
yes,
I never had the permission to share with them. So now you're giving me permission. I'll share it with them.
ma'am, don't say like this to me. You are
Dr. Jahangir, still, like if you share something with me, then I need to have
yes, yes.
permission to
Thank you,
share
ma'am.
it
But
with others. Yes.
we are
You're very
grateful to you,
confident,
ma'am.
sir,
We
while
are very
going to the
much
exam
grateful.
also. I have joined the group. You're like you are going to the exam like in a 2 weeks or so. Before
Yes,
you going
yes.
for the appearing for the exam, I could feel that you are going to pass definitely.
Oh, thank
Yes.
you, thank you.
You are
Everyone
so
said like
confident.
that. That is the preparation. So when everyone will say that you will pass or definitely pass, then you will can assume that your preparation is good. Now you're ready to go for the exam. If luck favors with you, then you will pass. Okay,
Sir, got it.
but you can make your luck. You can make your luck. If you take a very good preparation, you will definitely pass. My exam was I'm very bad. You cannot imagine how bad my exam was, even though I passed because of extreme good preparation. So you have to take an extreme good preparation. Then whatever the exam is, whatever the question is, whatever the stations are, whatever the center is, you will definitely pass.
Yes, someone has written a question here, Dr. Jahangir, for you. Which center is better? They want to know. UK's or international for OSCE exam?
Oh, so can I? That's me actually. Can I
Yes,
speak
please.
here?
Yes, please, of
By
course.
yes. So Dr. Jahangir, hi. It's one of the first sessions I'm joining, and I have been following the YouTube videos. So I'm a CT1 trust grade in East Surrey Hospital, basically. So that's why I wanted
Yes,
to
yes,
ask Dr. Jahangir
yes, yes.
about MRCS B. Okay, what is the best? Which one is the best, like an international one or one in England? Because of the present scenario,
Mhm.
RCS England has closed their booking, RCSI has closed. So you know, you have vast amount of experience, and from other members who have given, and Dr. Samreen herself, if you could give your input regarding which center would be fine, you know, that would be really helpful.
Now you are living in UK.
Yes,
Are
yes,
you
sir.
living?
Yes, sir.
Oh,
East
fine,
Surrey Hospital. I'm CT1 trust grade
fine, fine.
in
That's
general
pretty
surgery.
good.
Yeah,
CT1 is
yeah,
good.
So
yeah.
I appeared from London Center. I
Okay, sir.
found that it very comfortable, very nice. And you
Yes, sir.
know, London Center is the heart of all MRCS centers, the main
Yes, sir.
center.
Okay.
So I'll recommend you if you have, um, if it is comfortable for you, then you can appear there.
Yeah, that's the closest to me. Yeah, but there's no bias, or then there's, you know,
No, 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 no,
uh,
nothing, nothing,
nothing,
nothing.
nothing like
You
that.
know, you will feel very comfortable, and
Okay.
they are very gentle, good, humble, and you have to just take a very good preparation. That's the thing.
Oh, okay, sir.
And there are very nice hotels around there. If you have to stay hotel, you can
Yes,
stay
sir.
there.
Yes, sir. I'm
And there
aware
is
of.
a walking
Yeah.
distance from the hotel, the center. The hotel I stayed, it's just
Okay, sir.
I walked from there to the center.
Okay, sir.
So and the center where the exam will held. It's a MRCS emergency surgery department. What is called? Yeah, this is.
Okay, sir.
So
All right.
this is a
All right.
very located in a very good scenery.
Okay, sir.
So you will feel comfortable. You have to take a just very good preparation.
Thank you. Thank you, sir.
You're welcome.
Okay.
Among the UK centers, if you ask me, I would prefer Glasgow best. But
Mm-hmm.
now,
Yes,
yes, Dr. Jahangir has personal experience of London. Then, yes,
yes, ma'am.
okay, yes, I respect that. But
Ma'am,
Glasgow, yes.
One of my junior colleague, I told you about him. He appeared from Manchester.
Okay.
He also passed from Manchester.
Yes.
He was very happy and comfortable with the center. We
Yes.
discussed a lot. He said that Jahangir bhai, the examiners were very kind, very good.
Yes.
Their attitude. He was very happy. Manchester.
Yes.
He appeared in Manchester, and I appeared from London. I am also very happy.
Yes.
So I think centers doesn't matter. I told
Centers
just
doesn't
before.
matter. Yes.
Yes.
But
So-
one thing
Because I want
matters.
to ask-
Yes, please. Who wants to talk? Yes,
I wanted
please.
to ask about Manchester before. I wanted to ask about Manchester because I booked my exam for May
Yes.
in Manchester.
Manchester.
been postponed.
Okay. Okay.
Do you have any tip about Manchester Center?
Yes, Doctor.
Yes. Manchester Center is a very good center. Don't worry about that, ma'am. Can I say one or two things?
Yes, of course.
Those are living in UK, appear from UK, appearing in UK center. If possible, you should take coaching organized by MRCS just before
Yes,
15
tell
or 20
them.
days.
Yes,
And
yes.
ma'am also recommended that.
Yes, tell them please about your experience. Yes.
It's very, very effective. Believe me.
Which
Yes.
coaching to be specific?
MRCS preparatory course.
Yes.
Or yes. OSCE exams preparatory course. Please
Sir,
tell
do you
them,
mean
yes.
that? Sir, do you
Ma'am,
mean the
that
Tommy's course?
That
the
one I
same
had in
process?
Hyderabad.
No. It is organized by MRCS Royal College. It is organized by
Yeah,
MRCS
brother.
London,
I have
MRCS
attended the
Glasgow,
Hyderabad course.
MRCS
in
Edinburgh.
January.
Okay.
Yes.
Yeah, after the exam, they just take 1 day preparatory course and they just give demonstration about the counseling and the thing by the actor-actress and simulated patients, and then they take a mock exam in the cubicles, like as the exam scenario, ma'am.
Yes. Yes.
That's very helpful, I guess, ma'am. I had no idea about
Yes.
this
Dr.
station.
Jahangir will tell you his experience. He will share. Yes.
Yes. Listen it very carefully. Those who will be appearing in UK, especially in UK.
Yes.
If you appear UK in under the College of Glasgow, you will take the coaching from Glasgow.
Yes.
If you appear from the Edinburgh, take the coaching from Edinburgh. If you are appearing from London, take the from London College. But in my time, I booked from London College as I am appearing from London. But 1 month before the exam, they send me a mail that they are not arranging any coaching this year. Then I booked from Glasgow. The important thing is that in Glasgow and Edinburgh, the anatomy, especially the anatomy specimen,
Yes.
they will show you in the preparatory course. That same specimen will be in the exam.
Yes.
This is a very secret thing. Please don't disclose to anyone this thing. But keep it in your mind. If you appear in UK, you are appearing from Glasgow College, you definitely join the coaching or will be organized by the Glasgow, not any other one. Royal College of Glasgow. If you are appearing in Edinburgh, please attend the coaching organized by the Royal College of Edinburgh.
Yes. Because the
Jahangir bhai,
models
they
or
have-
pictures or yes samples that they
In
use.
Hyderabad, they have showed us only the pictures in different station, like different pictures for pathology and the scenario for critical care. So
Okay.
just you are saying that they only take exams with the pictures like this, as they have
No,
shown.
no.
that. No.
But I attended
It was
1 day
Hyderabad.
coaching
It was
in Glasgow.
Hyderabad, brother. Yeah.
Not I am telling about that, but they show the real anatomy
Yeah,
professions.
they have shown. Yeah. Even they have showed us the structured question that was handwritten. Like if you see, you can see the questions.
yes.
They are very friendly. Trust me. Yeah.
Yes. And before exam, when you have a very good preparation, you know everything. Before exam, this type of mock test will just boost up your preparation and boost up your confidence. But don't attend anything with private organization or those who are running for money only, not with those people.
Yes, individuals.
They cost.
Yes.
They cost £100, I guess, brother. Right?
I wanted to join Dr. Exam's mock test, but ma'am
Yes.
discouraged me, and
I
she always
give you my
recommended me.
honest
Yes.
honest advice.
Yes. So ma'am told me that joined authorized one. Then I joined Glasgow, and it was really helpful.
Sir, sorry, just one question. I'm unfortunately I tried booking for the London Center, but then it was closed.
Yes, yes.
So I had to book it for the one that's happening in Sharjah in October. So am I still eligible to go to the London RCS for the mock exams?
Yes, yes. Mock exam. You can
You
take mock
can,
exam.
but it will not
Yes,
help you that much.
yes.
Okay.
Ma'am, she will get a good idea.
She will
She
get
might get
idea,
a
but
good.
her
Yeah.
center, if it will be in Sharjah, then I don't think they will carry the models and things to
No, no, no,
Sharjah.
no, no,
They'll
no.
have different models and different
Yes, yes.
specimen in Sharjah.
Okay, ma'am. No, I was just
You're
okay.
not following the point. Yes.
No, ma'am. I was just asking about how it is in general, not about the specimens as
Oh,
such,
But
okay,
but
okay.
whether
I
I
think
can go.
London,
Yes.
I think London College are not arranging this kind of
Anymore.
coaching
Yes.
anymore because I was the last one who applied, but they cancelled at that time.
Okay,
So
thank you,
this
sir.
time,
There is
yes, you're
another
welcome.
question. Dr.
And
Muhammad has a question. He wrote in the chat. Yes, please, you can ask. You wrote long ago. Yes, I have a question he wrote here. Yes, please. Dr. Muhammad, you have a question to Dr. Jahangir? Is he in the list? Anyone
Hello.
else? Yes, please. Yes, please.
Yes, I'm asking about uh, how to how to control the knowledge part, as every exam there is new stations. So how can we control this?
Control means prepare. Yes, Dr.
Yes,
Jahangir.
yes.
Yes, please.
Prepare
yes,
is
yes,
how to it's increase reading more books or what?
Yes.
yes. Don't worry about that new station. Don't worry about these new questions because if you take proper preparation, follow this group and what will discuss every day, then you will get almost 80% question. So
Okay.
for 20% you need not to worry about that. If your luck clicks, then even though you can answer that 20%, if you have some basics or residual knowledge, or uh, you might have collect somewhere else from your brain, hidden somewhere in the exam. If you're lucky enough, you can able to answer some in some stations 100%. But you can surely answer more than 80% if you follow this group, attend every day. Everything is discussed here.
Okay.
Nothing that new station will happen suddenly. There will be new case, a new thing that will not happen that much. Don't worry about this.
As
And
there will be changes from October, as there will
Yes.
be only
Yes.
uh, three clinical sets rather than four, and there will be new communication skills.
ma'am, are they implementing this thing from
Yes.
that
From
coming
October.
exam?
Yes.
Yes.
They have
So
announced.
it's a good news. The one you have to they'll reduce one station. So
And
at
they are
first,
introducing one pilot station, and they are reducing one anatomy station. So
yes,
yes, and there'll be, I think, 3 or 4 communication stations, and yes, so they are doing little changes, but nothing to worry about. It will be easy.
nothing to worry about it.
Yes.
Preparation is the same.
Yes.
Preparation is the same.
Yes.
Eh, the
Okay.
the main thing is you have if anatomy is, there is we used to appear anatomy. How many station? One, two, three. I forgot 3 station.
Yes.
Ma'am, I appeared in the exam. It had 3 station
Yes.
in anatomy. So in the coming exam, there will be 3 station or 2 station.
So
3.
I think 3 stations.
Three
They are
station.
reducing the physical examination station
Yes.
from 4 to 3.
From 4 to
They are
3.
going to reduce one clinical examination station and they are going to introduce one pilot station.
Yes.
Yes, yes. But anatomy is the main thing to carry marks. Remember that. take
Yes.
very good preparation with anatomy. In anatomy, you can score 60 out of 60 from 3 station.
Okay.
Because
So,
in past, most of the Asian or most of the students from Asia used to fail in the in clinical station. But nowadays, most of the students are doing fail in the knowledge station.
yes,
Yes.
I entered the exam once and I pass skills, but I fail knowledge.
Oh, I'm sorry to hear about that, but don't worry, brother. You will definitely pass next time.
Yes,
Definitely.
definitely.
Inshallah.
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 And ma'am, I want to give one information.
Yes, yes.
If they want to know what is the pass mark
Yes, there is some noise somewhere.
for pass mark in uh, the sound is not clear.
Yes.
For knowledge part, you have to score in between 110 and 115. Uh,
Yes.
it's sometimes 110 or 120, but 115 is the safest number. If you get 115, 115, 115,
Yes.
you will surely pass 115. But sometime you will pass in 110, 11, 12, 13, 14, or sometime 18. But
Yes.
115 is the, you can say, sure pass 115 in knowledge. For clinical is 130 to 140. So 135 is the surest. 135 sure pass.
Yes. So, Dr. Jahangir, tell them how did you prepare for examination stations and procedures skills you've already discussed. Since you
For
didn't have,
for
yes,
exam, yes. As I took my preparation alone,
yes,
and so I used to practice. I used to practice with my son
yes,
and with my wife. So I made them patient. I used to practice like in real exam. I used to keep a sanitizer in front of my table,
yes,
and I always used to wash my hand.
and timer.
And yes, not at the beginning, not with timer,
Okay.
but at the end with timer.
Yes.
At the beginning, you will just practice that you have. So it would be very nice if you can record with a mobile camera. If you then after that you can watch and you can see that what are the points you just missed.
Yes.
It's very important. The most important is the examination. You have to practice because in exam in front of patient you will just forget the steps if you don't practice well.
Yes.
Believe me. Someone will say that I practiced 1 to 2 times. I just enjoyed the game. I passed.
Yeah.
They are not trying to help you. They are not trying to help you.
Yes. And how important or how relevant are
30
these
times practice for each patient. 30 times.
30
What the ma'am
times?
said.
Yes.
30 times. Believe me. Everything will be reflex to you. Just all the steps will come like smoothly like a piano with your hand in exam. If you practice 30 times.
Yes. Thank you.
Just
And what
all time.
about those?
Whenever you will get time, you will tell your wife, you will tell your son, you will tell your sister, or you will tell your mother, please lie down. I will have to palpate your abdomen. Just look from the side of the bed, look from the foot end, look from the right side, and uh, then proper exposure, then move chest movement with respiration, then superficial palpation, then deep palpation, then where there is a tenderness, you have to palpate there at the end, like this thing. And I want to share one important thing. If ma'am you allow, then I can
Of
share.
course. Why? Yes. Why to
In the
ask?
patient with pulmonary embolism, the most
Yes.
interesting thing is that the patient is lying on the bed and he is admitted patient. So there is a wristband on his hand and there is the oxygen mask. There, you at first you will be puzzled. What I have to do? The patient like almost like sleeping. The oxygen mask. No one is moving. And so first, whatever they are doing, whatever they're shouting or they're sleeping, you should not bother for that. You just enter the room, hello, I am Dr. That. I am Dr. That, and I am to examine you. Do you mind to tell me your name and age, or you have to look at the wrist belt? Then, then his appearance showed that he just wake up from the sleep. Oh, then you have to just do you mind if I just remove the oxygen mask for a while? If you feel discomfort, then I'll put it again. Then, and what is your problem? Where is your pain? Then I examine everything, but there will be no sign of his leg pain. He is hiding everything in the bed, under the bed sheet, under what is called blanket. He is wearing a blanket. Then I said, do you mind if I remove your blanket, please? Do you mind to show me your legs? So he said that I have nothing in my leg. Then let me see your leg, please. Then I said temperature. When I just touched his calf muscle, then he, oh, pain.
Right. Yeah.
Then in exam, if you don't practice it 30 times, you will forget definitely to touch his leg, calf muscle.
Yes.
If you don't touch his calf muscle, examination in the station of pulmonary embolism, you will not get mark. Be sure about that.
Yes.
Patient with pulmonary embolism you have to touch the calf muscle, check the calf muscle, where there is a pain. And I said, do you have any pain in your leg? No, I don't have any pain in leg. He said that. Then when I just touched the calf muscle, he shouted, oh. Then I really enjoyed this thing.
Yes.
Dr. Jahangir, I have a question. Yeah, for
Yes,
patient with pulmonary embolism, are we to approach the patient with normal respiratory examination or with
yes. CRIS protocol.
protocol.
CRIS protocol. You have to follow the CRIS protocol. So I started in like that way. I said the examiner, as my patient is very ill, very serious. He is having oxygen and he is having serious respiratory depression. So I want to examine this patient according to CRIS protocol. Then
But,
examiner say, okay, proceed.
but the patient is under examination, right? That's
Yes,
one
yes.
of the four. Okay.
And I had also one patient with ankle sprain. The patient in the stamp it is written that this young boy during playing just got injured, hurt his ankle 1 day ago. So it's acute case. 1 day ago he got injured in his ankle. So the patient is in serious pain. Whenever I touched his leg, he is shouting for the pain. So
Okay,
how will we
yes.
examine
It
this
was
patient?
our scenario today. So tell them,
Oh,
how did
that's
you
fine.
do? Very good.
That's fine.
Yes.
Yes. Sometimes you will forget to prepare yourself with the ankle joint, but ankle joint was one of my important station. So you have to examine somehow you have to examine the patient, but you have to be very kind, very gentle, be sympathetic, very empathic to the patient. Just you have to do an acting. You have to be a proper actor at that time. I just told that I know you are having so much pain. So do you mind to examine you? Then he said, okay, examine. Then in every patient with ankle, joint, hip, you have to tell them, please walk for me. So please notice that thing very importantly. So I told the patient that, do you mind, do you having severe pain? Or do you mind to walk for me? Then he said that, yes, I am having pain, but if you insist, then I will walk for you. The patient said. Then I suddenly said that, thank you very much, but you don't have to walk for me. If it increases your pain, please lie down. So I think this is a very important point.
Yes.
And the examiner looked very nicely at that time towards me. Then I realized that it will earn much point.
Yes.
Because then when we examined when we finished our examination, then we discussed with our colleagues. Then most of them made the patient walk.
Walk. Okay. Dr.
So
Jahangir,
that
which
was,
special test did you do
ma'am,
when
I
patient
did.
was in acute pain? Yes.
Yes, ma'am.
This we were discussing today. Yes.
Yes. I first do for any joint, look, feel, move. Look,
Yes,
feel, move is
yes,
the basic
yes,
thing.
yes.
First, you will look. As the patient was an actor.
Yes.
Remember this thing. The patient has an accident in 1 day ago, having severe pain, but he is actor.
Yes.
What does it mean? There will be no swelling there. but you have to assume that there is a swelling there.
Yes.
You have to act like there is a swelling because it's a 1 day history and the patient having severe pain. But the irony is that the patient is the actor. Yeah, there is no
Yes.
swelling. But I acted like this thing. A patient have a swelling. I compared with another leg, look, feel. Then I felt temperature, tenderness, whatever these things. Then move. Then first active movement, then passive movement. So during active movement, I can see there is no swelling, no pain, but patient is doing patient is acting that he cannot flex or extend and eversion, inversion. He is doing very slowly and having pain. So during passive movement, then I told that I know you are having very much pain, even though I will be as gentle as possible. Whenever you feel any discomfort or pain, please let me know. I will stop my examination instantly.
Yes.
Then he felt comfortable. Then I just touched the ankle joint very gently, just slowly flexed, extend, eversion. Very slowly I did everything,
Yes.
very gently,
Yes.
and looked at the patient's face. Always looked at the patient's face. Don't look at that side only. And don't ever think that this is actor. Always think that this is a patient and there is a swelling. There is a
Right.
fracture.
Yes.
Act like that way.
So,
And
patient made or
then, ma'am,
said it's pain when you
yes,
asked him
yes.
to do the
Then when
active
I
movements.
just
Yes.
yes,
Yes.
I don't when I'm moving the patient actively, and then he's having pain in his face, not that much, but I am doing very gently. Then I told the examiner, sir, I cannot go further, but I have to do anterior posterior draw test,
Yes.
talar tilt test,
Yes.
to elicit the proper pathology. As my patient is having severe pain, I cannot do this exam.
Very good.
The
Yes.
examiner was very happy. He was very
Yes.
happy. The
Yes.
patient was also happy. Then examiner said, okay, okay, you don't need to go further. What else you want to examine? There I made the mistake. I forgot to tell that I want to examine the knee joint as well.
Okay.
During any joint, you have to examine the
Joint
proximal and
above.
distal joint.
Yes. Above and
Yes.
below. Yes.
Then examiner again asked me, what else you want to examine? I forgot again. Then he told. Then he went to another question. What is your provisional diagnosis? What is
Yes.
your diagnosis? So I said that this might be ankle sprain. This might be malleolar fracture.
Yes.
Then what you will do? So at first I will manage it conservatively. I will elevate the leg, rest. I will give the rest. I will give proper analgesics.
Yes.
I will give cold compression, and I will do an X-ray. Then he showed me an X-ray with lower malleolar fracture, lateral malleolus fracture.
Yes.
Suppose this patient having this, then what he will do? Then I said that, sir, I will first consult with orthopedic consultant.
Yes.
Then he smiled. Suppose you are the orthopedic consultant, what will you do? Then I said that I will go for surgery as because it's a lateral malleolar fracture and
Yes.
it's unstable fracture.
Yes.
And then how will you do the surgery? Then I will fix it by a plate and screw.
Yes.
Then he became very happy. Then the bell rang.
Very good. Yes.
So, but even though I got disheartened with that station because I failed to mention the knee joint, then I thought I will fail. But when result came out and you told that we will pass,
One or two question doesn't matter.
it
Yes.
doesn't matter. Doesn't matter.
No
One, two
problem.
question. If you do extreme bad in two station,
Yes.
you will
Even
not.
then you
Don't
can
worry about
manage
that.
to pass. Even
Yes,
then you'll
yes.
manage to pass.
But not two station in a row. I want to mean that one station in knowledge and one station in clinical.
Yes.
You can do blunder. Even you can get 0 in clinical and in one.
Yeah.
So don't
Right.
worry about that. Don't worry. Just go straight next station. Forget previous one, and you can. Who knows? You can score 20 out of 20 the next station.
Definitely.
So don't bother for that. This thing happened with me. I discussed
Sir,
it several times.
sir, while doing a clinical examination,
Yes, yes,
while we are reading Bajid notes, it is mentioned that we'll be explaining patient each and every step. Okay.
yes,
So we'll be explaining patient. Likewise, we are letting the examiners know that we are knowing the steps. It helps in that manner, or we
yes.
can just examine without speaking anything? What
No,
will
no.
be his result?
Let me explain
Like
you. It will depend upon the situation. It will depend upon the situation. In everywhere there is a instruction that you have to examine ankle joint, but there was an acute ankle. It was just patient got injured just 1 day ago. He presented with swelling and severe pain, and he is acting like
Brother,
that.
if there is swelling not present, like on the examination finding, what should we tell? Swelling is present or not?
No, no, you should not tell the swelling is present.
Yeah.
No, no, you will not tell the swelling is present, but you
Right.
will keep it in your mind. There is a swelling, and I will examine in that way.
Okay, thank you.
This will be in your mind.
no, my question is like, suppose if I am doing any hand examination per se, then I will
Yes,
tell
yes,
them, okay, I'll tell the actor or the patient, I'll tell, I'm going to inspect your back of your hand, your front of
yes,
your hand. I look
yes,
for
yes.
nodules. I'm going to see for the skin. Okay, your
No,
skin
no, no,
is
no, no.
normal.
I am going to examine your hand. Are you okay with that? Do you have any pain at this moment? Finish.
Okay,
Then you examine.
okay. That then the inspection gets over. When you move into palpation, will you tell the patient that, okay, I'm going to look for few of your phalanx
No, no,
fingers,
no, no,
and I
no, no,
will.
no. Permission at the beginning, and once you took the permission at the beginning, you will not take any other permission for, especially in hand, in joint, like this. Like in abdomen, you will not tell that I am now palpating your liver, I am now palpating your spleen, I am not palpating your kidney. You will not ask for that. You will just ask, do you have any pain in your tummy at this present? Okay, no. Okay, I will now palpate your tummy. If you get any pain or discomfort, please tell me. I will stop my examination that time.
Then
Okay.
how will make our examiner realize that we are doing that step? Like,
examiner is Examiner
I
is
guess.
engulfing your exam
Examiner.
through his
Yeah,
eyes.
yeah, I guess so.
okay,
When
why,
they,
because
they
I
are the
have heard
examiner, they are the
one
examiner. They
one
knows
of your
what point you will miss. Close the door.
I heard one of your colleague, Dr. Meena,
Yes,
Yes,
has
yes.
yes.
done examination in this manner. So she makes sure that examiner also knows what she's doing, and
Now,
she
doctor.
herself is
Yes,
repeating.
yes.
Yes, I'll
Doctor,
ask her to
I'm
doctor.
come
asking.
sometime, yes, and tell
Yes,
you
yes. Dr.
exclusive.
Meena did that because she used to remember all the points, and she used to speak all the that she doesn't miss any of her point.
Yes. So
She
she
practiced
was
in that way.
doing it to herself, like she was like
She is
telling it,
doing it to herself,
yes,
not she.
not to the
She's
examiner. Or she was like repeating it to
yes,
herself,
yes.
but little louder, I think, yes. This
Uh,
is what she said.
it yes, that's also you can do, but this is not mandatory that you have to tell all the steps.
Yes.
She's doing, especially she's doing in her mind that she not might not miss any point.
Yes.
Okay.
But my main concern, my main request to all of you is that you have to practice examination more, more, and more. You have to now all of you are, I think, practicing in hospital or practicing in private chamber, wherever you will get a patient. Like you're now watching a patient in hospital. Patient has acute pancreatitis, cholecystitis, but a normal abdomen. You will every day you have to examine one or two patient like in examination every day. Make a routine, make a habit, then you will not miss any point.
Yes. Very good advices, Dr. Jahangir. Thank you so much.
Thank you
Yes.
so much, sir.
Any of you have any more questions? Ask him, please.
Oh, it's uh,
It's
late night in Bangladesh.
so what? They are getting yes,
But
golden
ma'am, now
advices right now. Yes.
now here is
Still
till
light.
10 p.m. Till 10 p.m. sun.
No,
There is a
yours is 9.
yours is mine is 9, but still there is a
Light.
shiny
Yes.
outside. Light is
Mine is
outside.
10 p.m. but still I have light. Yes.
Yes, yes.
Same. Yes. Almost. Yes. But these members, they know they are getting golden tips. Why would they go and sleep right now? They want to hear it directly from you. So that's
It's
good.
my pleasure. If I can help
So
anyone, that
it's
would be a
2 a.m.
great pleasure.
Bangladesh. Yeah, ma'am.
It's 2 a.m. Is it?
Yes, yes.
Oh, right.
Yes, ma'am.
Okay.
No worries, ma'am. Continue. It's really great to hear from Jahangir bhai.
Yes.
No, no, I am very happy that I am very delighted that madam, ma'am, let me
No,
to
Dr.
speak
Jahangir,
something.
it's your
It's a
own
great
group.
honor.
It's your own group. Yes.
So,
Actually,
Jahangir, how are you? I was just
Oh,
silent
Nadim
just
bhai,
to listen.
assalamu
yes.
Yeah.
alaikum.
ওয়ালাইকুম সালাম কেমন আছে
Alhamdulillah, Nadim bhai. I'm Nadim bhai.
Nadeem
Exam.
is
uh,
learning Bangla.
Yes, yes, ma'am. Ma'am,
Kichu
exam
jani
is
na.
waiting for Nadim bhai. Nadim bhai is not waiting for exam. Exam is waiting for Nadim bhai.
Yes.
Mashallah, he knows
And
more
he
than more than
declared the other
more than
day that
exam.
he has become legend now. Yes, he remembers.
I don't know everyone knows about him or not. I know that.
well just pray we are so much bored that exam
Inshallah,
comes
yes,
and
yes. There's the main agony now, waiting for the exam. This
Yeah.
is a
yeah
pain, very pain. And in this year, I think there will be no exam in Pakistan. What do you say?
They were planning, poor people,
yes
like
there
in April.
so I'll just see where they shift my exam like it's up to their discretion they
Right.
will shift it.
But you
Come
will
here,
approve.
come,
Yes.
eh, come UK,
Yes.
appear here.
Oh, yes. I should come there. So you are in which city? Like
I
just
am in
after.
I am in Norwich. It's very near to London. It's only two hours drive. In
Okay.
each day, ma'am, I drove to Cambridge. We
Okay.
went to Cambridge.
Yes.
There is a very nice park there. So my brother came, and that as we are cannot go one's house, so he came Cambridge that park. We met in the park in the day, and
Nice.
we
Yes.
did our lunch there in the park, the beautiful park.
Right. So, right. So I think everybody should be going for a rest. Nice talk to
Yes,
all
Yeah.
of
yes.
you.
Thank you very much. Thank you,
And
everyone. Ma'am,
we'll
thank you.
we'll hope that
Thank
we'll
you
see
so
more
much,
of you,
brother.
Dr. Jahangir.
Yes, ma'am. Inshallah. Now
Yeah.
I
Come,
found.
join daily because I think by that time Bhabhi comes home and she can take
Yes,
her, yes, her duties over from you.
yes, ma'am. Yes, ma'am.
Bye
And
bye.
ma'am,
Okay.
this will be the most likely. This will be the number. If you see this name Kulsum
Yes.
Parvin,
Yes. Yes.
you will think it's me. You
Yes.
will
I
assume that
I
it's me.
already recognized. That's why I let her in. But like I wasn't sure if it's Bhabhi or if it's you. But then when you wrote okay, it became clear to me. Now your sons are missing you.
Yes, ma'am.
They are missing
Thank
you.
you, ma'am.
They're saying bye bye. Okay, bye bye. Give
Thank
our
you, ma'am.
regard
Thank you
to
very much.
yes, Dr. Kulsum.
Yes, ma'am.
And yes,
I
thank
will
you
tell
so
her.
much.
Thank you,
Yes,
ma'am. Thank you very much.
hopefully
Thank
we'll
you,
meet.
everyone.
Thank you, everyone.
Thank you. Assalamu alaikum.
Bye,
Yeah.
Walaikum
Kulsum.
assalam. Thank you. Love you. Thank you.
There is only one station left. We'll do that tomorrow, if it's fine
Okay,
with
ma'am.
everyone.
Yeah.
Critical care.
No, ma'am. No
Yes.
problem, ma'am.
Yeah.
Or I can take a note. We can add it to another week. No worries.
Yes, or because I have prepared, I've got it with me. But then we
No,
can do it
no problem.
tomorrow. It's
Okay, ma'am.
already beyond midnight in your places, so take rest.
Yeah. Yes, so
Tomorrow
ma'am.
or some other day we can cover it. Thank you,
That
everyone.
was a great feedback from Jahangir bhai. Yeah, ma'am.
Definitely.
Just amazing. Yeah, ma'am.
Yes, that's why I
Oh,
allowed him to talk so that people can refresh their
yes, ma'am.
questions and knowledge and queries. They can clear their concepts. So it was nice. I'm going to post his discussion or interview,
Sure, ma'am.
so it will help others, those who couldn't join today.
Yeah, ma'am.
So take rest. We'll meet tomorrow, hopefully.
Thank
Good
you,
night,
ma'am.
ma'am.
Thank you so much. Thank you, everyone. Good night.
Ma'am. Thank you.
Thank you, everyone.
Good night. Yes.